Hello, Market Watcher. I'm David Ravel, and this is a special edition of ValueSide.com for Saturday, December 4th. For all of our podcasts and articles, visit ValueSide.com. Today, has Pfizer violated securities law? A fascinating story evolved this week involving Pfizer, one of the principal makers of the COVID-19 vaccine, the Food and Drug Administration, and a citizens watchdog group named Public Health and Medical Professionals for Transparency in Documents. Now, the story begins when the watchdog group sues the FDA under the Freedom of Information Act. They wanted to obtain the documents the FDA used in first granting Pfizer's emergency use authorization and then on August 23rd of this year in granting Comirnaty's full approval for individuals 16 years and older. Now, in reading the court documents, you will see that this group is just what their name says. Public health and medical professionals, essentially medical doctors and researchers who are trying to see how it was that the FDA approved the most impactful medical treatment of our lifetime, a treatment which literally touches the lives of every American and to this day has forced major changes in our day-to-day behavior. Now, the group is responding to the controversy which surrounded the FDA approval and wanted to get to the bottom of exactly how the approval was granted. So they asked the court to make the documents submitted by Pfizer to the FDA public. And to make a long story short, the court granted their request. What we're referencing here is the first of what will become many, many supporting documents. The first report is entitled Cumulative Analysis of Post-Authorization Adverse Events Reports received through 28 February 2021. This report was provided by Pfizer to the FDA. So this is very important. What has occurred is that the FDA has released a Pfizer report used in their vaccine approval method. Pfizer did not release this report directly, and that's critical in our later analysis. Now, in reading the report, the standout number appears on page 7. It is here that Pfizer reports that there had been 1,223 deaths directly attributable to the vaccine through Feb 28. And we'll use that gruesome statistic as our benchmark throughout the discussion. 1,223 deaths. But there were also references to other adverse effects, and all of them were also elevated from what was disclosed to the public at the time. 1,223 deaths by the Pfizer vaccine through the end of February. Now, the CDC's system for reporting adverse vaccine effects, called VAERS, reported only 623 deaths through the end of February. And that included all three vaccines, Pfizer's, J&J's, and Moderna's. So as many suspect, VAERS is way off, and conceivably may have misstated the actual number of vaccine deaths at that time by a factor of 600%. So at that point, I'd like to leave the good doctors at public health and medical professions and thank them for their incredible service for providing this information needed for everyone in the country to make a truly informed decision on the vaccine. But for us, that will be a discussion for another day. For today, I want to focus on the Pfizer's disclosure problem. By now, we've all heard that Pfizer, as a vaccine maker, does not face any liability. This is because of a law passed back in 1986. Fine, I accept that. But remember, Pfizer is not just a vaccine maker. It's also a publicly traded company. Its stock trades on the New York Stock Exchange under the symbol PFE. As such, Pfizer is subject to all of the laws and regulations for publicly traded companies, specifically those provisions which come under the Securities Acts of 1933 and 34. Now, I'm not a securities lawyer, but I've been in the industry for a very long time, and my understanding of these provisions is that it's absolutely imperative that a public company disclose all of the material facts about its current operations. Generally, this is done by quarterly and annual reports to shareholders. These are the earnings reports that you may be familiar with. Each quarter, the management of a public company will announce, generally through a conference call, along with supportive documents, exactly how the company is performing. All of the relevant events which have occurred over the last 12 weeks or so should be brought up at this meeting. For Pfizer, over the last year, has seen 3 quarterly reports produced and an annual report. Now, I've been through all 4 of these documents, and I can find no reference to the 1,223 deaths attributed to Pfizer vaccine as of 28 February 2021. To me, these deaths are a very material fact, perhaps the most important material fact, on the operations of Pfizer during that period. It goes to the heart of the efficacy and safety of their vaccine. That was a vital point in first the approval and now the continued use of the vaccine. Now, at this point, some may drift off into a discussion of whether 1,223 deaths is an acceptable price for providing the vaccine to the populace and potentially saving other lives. But that's not my point. Don't drift there. The point of this discussion is disclosure, a fundamental responsibility of every publicly traded company in America. It's a requirement of U.S. securities law. And the question is, has Pfizer failed to disclose a critical material fact of their operations through at least February 28? Few would argue against the proposition that by omitting this negative event, Pfizer helped boost their stock's price. Fewer deaths reported at least implies that the Pfizer vaccine is safer than it actually was. A quick look at Pfizer's stock chart shows that this is a company which has benefited from very positive price action in the market. Then the fundamental question is whether Pfizer disclosed all the relevant facts in reporting its corporate results. While Pfizer may face no liability for its performance as a vaccine maker, in my opinion, it could face substantial liability for its performance as a publicly traded company. And that's a special report of thevaluesign.com for Saturday, December 4. For all of our documents, references, and a copy of today's script, go to valuesign.com. I'm David Revelle. ValueSign is independently written and researched. The views expressed are strictly my own.